Hi, I'm Dr. Katie at Cornerstone Health in Evanston. I'm a chiropractor here, and my favorite exercise to use to help patients progress from sciatic nerve pain is the dying bug. Here's how we do it. I'd like to show you an exercise we like to use with our patients to progress them out of that sciatic nerve-like pain that they experience. When you have a sciatic nerve pain, there's oftentimes pressure in your lumbar spine that's causing a referred pain down the leg. A great way to reduce that compression is to have a patient lie here on their back. You're going to go ahead and do a glute bridge to put your back flat on the ground. And you're going to practice that NZR1 breathing that we're really good at. So you're going to want to expand the belly fully, and that helps to get that distraction on the lumbar spine. The next movement for the dying bug is to have a full pressure in the belly and arms and legs come up. This is a triple flexion position here. And so he's going to maintain this neutral lumbar spine while allowing the extremities to move in a safe manner that takes pressure off that painful symptoms. It's done in a contralateral pattern, so you can move the opposite arm and leg down together, maintaining that spinal stability and intra-abdominal pressure. One way to progress this movement is adding a ball to it. So instead of having the arms and legs come out, we can hold the ball in the center and bring one knee here and one hand here and create a force between your hands and your knee that allows you to create that pressure without moving the extremities.